Welcome back to episode 2. I'm Dr. Tabor Smith, and today's episode is titled Chasing Low Back Pain. And the reason we picked this specific title is because this is what most people are doing in our society today. We're not looking for a cause. We're not looking for the prevention or the improvement of health. We're looking at covering up a symptom. And I always go back to the biggest contradiction in our healthcare system today is the fact that it's called healthcare, when in fact it should be called sick care. Because if you're healthy, you're not in it. If you're sick, you get in it. And so it's really, in what we call it, is sick care. Healthcare is true prevention. Healthcare is understanding that there is a cause to what ails you. There's a cause to that symptom. And being a chiropractor, we see back pain in our office all day long. And people come in with this preconceived notion that they're in my office just to treat back pain. And I tell them, you know what, you could go take an Advil, you could go take a Tylenol, you could go take morphine, for that matter, and you could cover up this back pain. But did it touch, or did it prevent, or did it help at all the actual cause of that problem? And the answer to that is no. So the biggest point that I want to make in today's episode is that if all you do is constantly chase low back pain, then you're going to be on one drug after another, You're going to go to one surgeon, you're going to go to another surgeon, and you're never going to find this true answer. And you're going to wonder why your back continues to break down, why you continually have these problems over and over and over. And it's not your fault. It's the design of our healthcare system to actually just treat your symptom and not look for the actual cause of disease. And when we talk about disease, we're talking about degenerative disc disease. We're talking about spinal degeneration. We're talking about something that affects 96% of the people by the age of 80. So you can count yourself, more than 9 out of 10 people will have spinal decay. And you can bet if you're listening right now, there's a good chance you're one of those. And so I want to encourage you, if you're having back pain right now, or if you have a loved one or you know someone who's having back pain right now, that person is already experiencing an issue in their spine, because we'll have 60% of damage in some cases before we actually feel pain. People don't realize that your nervous system is 90% sensory. And 10% 90% is function. It actually controls our organs, controls our movement. My brain's sending messages to my heart to tell it to beat, my lungs to tell it to breathe, my stomach to tell it to digest. But only 10% of our nervous system is actually used as conduction of pain. And so if we don't have pressure, if we don't have irritation on that limited 10% of our nervous system, then you don't feel the pain until it's too late. It's why when people have heart disease, they don't feel it. My mom passed away at the age of 47 years old. She died of a massive heart attack in the middle of her sleep. And I always tell people, if you could go back into time and you could ask my mom, how do you feel? On the day she died, you could ask her, how do you feel? What do you think she'd say? She'd say, I feel fine. Because you don't feel chronic degenerative diseases like heart disease or like spinal degeneration until it's too late, until it's built up to such a point, then it begins to affect that 10% of your nervous system that carries pain. Cancer is no different. We see this more and more in our society. My grandfather passed away of lung cancer in his early 70s. And when I say lung cancer, a lot of people think he was a smoker, but in fact he wasn't. They did a health history. They looked back into his past and they found out that in his 30s and 40s, he was a plumber and a pipe fitter. And he was exposed to a chemical called asbestos. We now know that asbestos leads to a form of lung cancer called mesothelioma. But look, here's the point I'm trying to make. If they diagnosed him with lung cancer, if he was exposed to asbestos in his 30s and 40s, that means for decades there was something inside of his body that was growing, that was getting bigger and bigger, and he never felt it, but eventually killed him. And his biggest symptom was a cough. That was it. It was enough to make him go to the doctor and get a prescription of antibiotics. But after that, antibiotics wouldn't touch it. They sent him for x-rays and sent him for MRIs and CT scans. And they diagnosed him with lung cancer when it was already stage 4, and he died 6 months later. So my point, are more people dying of things that they feel or things they don't feel in our country? obviously things they don't feel. As we progress in this podcast, in fact, in the next episode, we're going to dive deep into what causes spinal degeneration. Because just like we said in episode 1, if we can, through deductive reasoning, if we can find out what causes this disease, what causes spinal degeneration, then we can give ourselves the best chance of decreasing our risk or trying to prevent spinal degeneration by preventing or correcting the cause of it. So stay tuned. This episode, Chasing Low Back Pain, it's a point I had to make. It's an episode we had to do because if you are chasing low back pain, you're going to continue running until you're exhausted. Stop chasing low back pain. Start looking for the cause of disease in your body, and we're going to do that in the next episode. So stick with me. We'll see you next week.